name is Wolf the Skipper, and known to some as Mr. Self-Empowerment. And as always, folks, we have a dynamite show on tap for you today. We're taping live at the Society Lounge, 8229 Georgia Avenue, Silver Spring, Maryland. If you need the zip code, I can give you that too. It's 20910. Please help me welcome two very distinguished gentlemen. They really don't need no introduction, but it wouldn't be right in 2013 if I didn't do it the right way. So I am going to introduce them individually. We have as a co-host today, a guest co-host, Mr. Eugene Helms. He's the CEO of Helms Fitness. Please give him a round of applause. There's nothing but love at the Society Lounge. Nothing but love. This gentleman sitting right next to me, as I said earlier, he really don't need any introduction. He's a good friend of mine. He's also my doctor in the practice. We're going to talk about what he does. He goes by the name of Dr. Tappan. Please give him a round of applause. Well, it's no secret that it's 2013. You guys are impeccably dressed. Before I left home, I told my wife, I said, sweetheart, I'm going to pull out this blue suit that I haven't worn in a while. I thought I was going to have everybody beat. So I'm going to blame that on Sharon that I didn't do a good job. Let's start with the wardrobe before we get into the business. Guys, who dresses? Is that a loaded question?
I wouldn't expect it that question. I know for me it's a combination of both. My wife and I, so
okay.
Today she dressed me.
Okay. And what about you, Dr. Tappan?
I've used a couple of people. One of them is your client,
George Clayton?
George Clayton. I've got some of my stuff from him, Everett Hall.
Okay.
And Hyde Company out of 216, Fulton, Maryland.
Okay. Okay. Well, I just wanted to start off by telling you guys, you are impeccably dressed. I don't think I'm too low or behind, but at the same time, I want to put you guys out there. Well, folks, it's 2013. One of the things that we all need to do from time to time is make a trip to the dentist. Dr. Tappan is not only a good dentist, he is a great dentist. To me, he's one of the best dentists in the world. Yes, I'm putting it out there. His staff is great. Everybody is great in Dr. Tappan's office. Now, Dr. Tappan,
yes, sir.
Let's talk about your practice a little bit. I want to go back and have you talk about a little bit about how you came into dentistry, what motivates you to continue to be in dentistry, and then we'll talk about some of the other facets of it.
First of all, I want to thank you for having me on your show. It's always a pleasure to come on your show and work with people and see a couple of my patients out in the audience, but it's always a pleasure to be here.
And we're glad to have you. Anytime.
Thank you very much.
You have an open invitation.
I appreciate that. I started my interest in dentistry at an early age. My parents used to take my sister and I to the dentist, and my dentist would just let me run around the office, play with the water gun, and just, I got interested in dentistry because my dentist was so open with letting us play in his office. I figured, wow, this is a nice profession. He seems to be having fun. And as I went through school, as I went through college, I found it to be an interesting thing to do. I worked with the dentist while I was in college, and interned with him for a while. Got to get my hands wet, as they say, and found that I really liked it.
And obviously, in getting your hands wet, you found out that this was something that could be possibly a passion for you.
Absolutely, yeah, absolutely. I think I did develop a passion for it. So I just have this need to want to make people look better, feel better. With me, it's a health issue too. I just feel like by doing something to help other people, it helps me help them.
Well, one of the things I like to say before I have Eugene jump in is I am one of Dr. Tappan's clients, patients, whichever way you want to call it. And your staff, I want everybody to know, your staff is just awesome. I mean, I talk about your staff all the time. I talk about as soon as you walk through the door, they greet you, they say hello, they do all the special things. And my wife will tell you, both of us are very big on customer service. And I think in the future, you might want to add teaching the customer service course to some of these other establishments out there as a part of what you're doing in terms of some of the future stuff that you have.
Absolutely.
Just a
thank you for saying
Eugene?
Believe me, one of the things I want to talk about as far as health issues. Right. You have a lot of people that may have different types of health diseases, and having those types of things that can affect their overall health. So, my wife is a doctor. Sure. It's so important to educate people who don't may understand that it's very, very important for you to go and get your hourly or yearly checkup, and also if you have any type of ailment that you need to get those things taken. So those are some things that we always say people are looking.
Well, basically, a lot of people don't realize that if you have dental issues, it can affect your overall body. There's a thing called bacterial endocarditis. It develops heart problems based upon the plaque and calculus that you have going on in your mouth. If you have a buildup of plaque and calculus, it can get into your heart valves, and it can really cause death. Abscesses that you may have from a tooth that has a hole in it or a cavity can lead to death. It can get into your brain. It can literally kill you. So people don't understand that the whole dental issue, it's related to overall health. If you take care of your mouth, 9 times out of 10, you're taking care of the rest of your body. And if you're taking care of that, then usually you can find things before they happen. You can be proactive, and you can treat them from that standpoint.
Well, one of the things, Dr. Tappan, we're going to wrap this up and take a commercial break, pay some bills, but one of the things that I would like to say to, again, everybody that's watching the show is that making your way to the dentist is very important. I have a little story, I'll share it with you when we come back. In the meantime, don't turn the channel, stay tuned, we'll be right back. Roland Grimes, National Sports Entertainment Show. Sports Entertainment Show. I have two very distinguished gentlemen. Let me reintroduce them to you again, just in case you didn't see the first half of the show. To my far left, the gentleman in the impeccably, I think it's green, but it may be another color suit, with the pink tie, Eugene Helms. He's the CEO of Helms Fitness. And Dr. Tappan, the gentleman sitting right next to me, is a great dentist. Now, before we left, I said I was going to share a little story with you about my dental experience. I'll be very quick because it's not about me, it's about these gentlemen on the show, especially Dr. Tappan. I had a fear of going to the dentist because I had a bad experience. I went to have some dental work done, and my wife can attest to this. She had to hold my hand. I am a strong man, 6'3", 215, so I'm not afraid, but that experience haunted me for 10 years. I had a bad experience and did not find my way back to the dentist for 10 years because of that awful experience that I had. So folks, if you're out here listening and you have a fear of going to the dentist, I can personally understand what you're going through, but don't let that stop you. I made it to Dr. Tappan's office, and let me tell you, it's the best thing that I could have done. Now my wife, when it's time for me to go to the dentist, she don't have to remind me. I'm at Dr. Tappan's office, ready to go, hanging out with the staff. I don't need as much medicine anymore. I am a walking miracle. So if I can do it, you can do it. Now, back to you, Doctor. Did I say anything wrong, Doctor?
No, you're
I was a basket case.
You had a basket case, and we were able to relax you. But years ago, I came up with this idea of what I call total relaxation dentistry. It's much easier for me to work on a patient if they're relaxed. If someone is nervous or hyped up, it's very difficult to do their treatment. So by bringing that patient down, calming them down, and relaxing them, it makes the whole process go easier. I try and combine that with giving fairly pain-free injections. You know, I try not to hurt people, I try not to scare them. I explain to them what I'm doing, why I'm doing it, and it just makes everything go easier.
Well, now before Eugene jumps in, my understanding is that you perform services for some of the high-profile basketball players, football players, gentlemen that hails from the area that's doing extremely well in the NBA. I think he's already won 3 NBA scoring titles, or 2, maybe working on a 3rd. Yes, I'm going to say the gentleman's name is Kevin Durant. Absolutely. Now, do you find that there's a vast difference between working with some of the celebrities versus working with just what we would consider to be normal folks?
Most of them are never on time. I can't tell you that. No, Kevin, I'm sorry, but what can I say? There is no difference. Okay. I try and treat everybody like a celebrity.
Okay.
You know, my goal is to treat everybody like a star because I believe that everybody can be, and my goal is to just do that as a patient, as a friend, as a mentor. You know, whatever I'm doing. My parents taught me years ago that there's always going to be somebody higher than you, there's always going to be somebody lower than you, but everybody's just the same.
Exactly.
And that's the way I try and treat my patients. from a standpoint of going there and demonstrating. I've been blessed to go and to have some celebrity athletes, some celebrities that come through the practice, and it's a blessing to have them think that much of me to come, because I know that they can go to any place that they wanted to go.
Yeah,
so it is truly a blessing.
Well, we're going to continue to commend you for the great work that you do. And folks, if you get tired of me saying that Dr. Tappan is one of the best dentists in the world, you just have to get tired of saying it. I'm going to continue to say it. Yes, he's my dentist. I am partial, but it's okay. It's 2013. You need to make your way to the dentist. Do not let your fear keep you from going to the dentist. Preferably, if you're in the Washington, D.C. area, that means Maryland, D.C., and Virginia, find Dr. Tappan. We're going to make sure we get all this information. We'll let him tell you how to find him and make your way to his office. You will never regret it, I guarantee you. Eugene.
Yes, now one of the things I wanted to talk about Tappan is that oftentimes a lot of people are scared to go to the dentist.
Yeah.
Now, could you explain the reason why you need to go to the dentist from a health benefit?
Absolutely, absolutely. A lot of people have had bad experience. Like Skip was saying, he had a bad experience growing up. I deal with a lot of patients who are phobic, and I've kind of developed that type of chairside manner to deal with people who have a fear of things. Most of the time their fear is from, as I said, a past experience. Sometimes it's just that they don't know or understand what's going on. I find it very easy to work on children because they don't have a reference point. You know, they've never had real bad dental work. Whereas adults come through, they've gone to 4 or 5 different dentists, they've been treated in such ways that their dental work is not good. So it's an honor and a pleasure to me to be able to sometimes correct that.
Exactly. The other one that I have is that when you look at some of your patients that they have deep pockets.
Yes.
And some where they have deep pockets where they may have bone loss.
Yes.
What do you suggest, or what would you tell the people out there that may be about to experience those things before it happens?
Most of the time, you're going to know that you're having a problem unless you see bleeding.
Yeah.
People think bleeding is okay, but if you were to rub your eye or touch your nails and they started to bleed, you would think something was wrong. It's the same thing with your teeth. When you have bleeding gums, it's a sign that you're having a problem. You're going to go from bleeding gums to infection, to pocketing around your teeth, like you said, which eventually leads to bone loss, and eventually your teeth are going to get loose, and you're going to lose them. Once you lose your teeth, it's very expensive to replace them. And whatever you put in as not your natural tooth is never going to be like your natural tooth. So, you know, the bottom line is you should always be seeing a dentist on a regular basis, and you should be able to keep your teeth as healthy as you possibly can.
Now, one of the things, folks, we're going to discuss when we come back, we're going to delve into a little bit more health issues, preferably with women that are pregnant. We're going to talk about women that are pregnant, how not going to the dentist, having some of these issues could affect your pregnancy. We'll be right back. We're going to pay some bills. Coming right back at you on the Roland GRIMES, Not Just Sports and Entertainment Show. Welcome back to the Roland GRIMES, Not Just Sports and Entertainment Show. We're going to keep rolling right on, folks. It's 2013. We're talking about making your way to the dentist. Well, Dr. Tappan, I've always been concerned as a father that has girls and also as a brother who has sisters. Can you talk a little bit about the importance of women that are pregnant as to why they should make sure as well that they make their way to the dentist to prevent some of the bad things that could possibly happen that could cause some issues with their pregnancy?
Sure, absolutely. A lot of women don't realize that, especially women that are trying to get pregnant, they don't realize that by having periodontal disease, they may be doing themselves a disservice in even trying to get pregnant. Because when you have periodontal disease, it increases your risk of having a spontaneous abortion, premature births, and having low-growth weight babies. Basically, material from plaque calculus that builds up in your mouth, travels through the bloodstream, gets inside the cervix, causes the cervix to open up. The body sees that as a foreign object, and it goes all the way through the bloodstream, all the way down to the woman's cervix. So a woman might be trying to get pregnant, not realizing why she's having these spontaneous abortions.
Yeah.
She's not going full term. So a lot of that can happen just based upon periodontal disease.
Well, now let me ask you this before Eugene jumps in again. Do you think that we have enough education right now as we go into 2013 about this one particular area in terms of women that are pregnant regarding their pregnancy and why they should if they went to the dentist?
No, I did not. Most people do not know that at all. A lot of women that I've spoken to about it, they have no idea that that can cause a problem. And you know, a lot of women, it's hard enough for them to get pregnant. Once they're pregnant, the best thing for them is for their baby to go full term. And when a fetus does not go full term, based upon something that could be an easy fix, then you know that should be noticed, and that's a problem.
Yeah, one of the things I want to discuss is two parts. One is flossing. Now, sometimes you might have a person that doesn't floss as much as they should. Could you explain to the people why it is so important to floss?
You see, most people think that brushing their teeth is enough. Flossing takes time, it's kind of hard to do. The problem is, most of the time you're going to have a problem, it's in between your teeth. That's where you start to lose bone. You don't lose bone necessarily on the face of your teeth. You lose bone in between your teeth. Because food, calculus, plaque builds up there, you can't get to it. It starts to push away the gum. When the gum is pushed away, then the bone follows. And that's why most people don't realize. It's like, oh, I brushed my teeth. I brushed my teeth. No, you got to floss, and you have to floss regularly if you want to maintain good dental health.
Now, did you have another question?
One more question. Brushing of the teeth. Can you explain to the viewers why it's important to not brush too hard?
Absolutely.
On your teeth?
Absolutely. Brushing too hard. Number one, when the bristles are stiff, they don't move. It's like washing your car with a hard brush. It's going to leave streaks in it. It's going to, you'll miss half of it because it just scratches through. What you need is a soft brush. It's going to be flexible and bend and get in between all the cracks and crevices. Brushing with a hard brush does nothing but cause your teeth to be sensitive. It can abrade your teeth also, but in most cases, the abrasion usually comes when you start to see recession. A lot of times, that comes from grinding. People think brushing hard causes that, but there's something called abfraction. And abfraction is based upon clenching and grinding that most people do because of stress, or they do because their teeth don't line up properly.
Now, Dr. Tappan, also, I want to get your expert opinion on why, let me rephrase it. There are people that have odor.
Yes.
And can you talk about why and how that odor derives in one's mouth that can be a very bad experience for someone, especially when you're in their space as it relates to dentistry?
I can give you a good example. It's like you walk into somebody's kitchen that hasn't washed their dishes in 3 days. Okay? It's garbage. It's food that gets stuck on the plate and it's like you smell it as soon as you walk into their kitchen. If there's a pile of dishes sitting in the sink, you're going to smell that odor. It's the same thing when you're not brushing and flossing your teeth, because that food that gets stuck on a plate that's hard to get off is the same food that gets stuck on your teeth, and if you don't remove it, number one, it binds to your teeth. It becomes hard and difficult to get off. Number two, it starts to give off an odor, because all it is just old food, okay, and it's starting to deteriorate. Just like garbage would in a sink, on a plate, or in a trash can. It smells the same way. You know it right off. And every now and then you'll find somebody that may have an illness. They may have some type of intestinal problems that would cause that same type of odor, but it's a different odor. Periodontal disease is a very distinct odor. And it smells like infection, it smells like old food, and it's hard for people to be around it. And they don't want to say anything because they don't want to embarrass you or embarrass themselves, but a lot of people want to be able to tell their friends and their family members, look, you need to go to the dentist, you need to get that taken care of.
Well, you know, throughout my years, I can honestly say that I have not found the right way to tell somebody that their mouth is not in great shape. Whether that is the structural part. From now on, folks, you're gonna see Wilbur Skipper, Mr. Self-Empowerment, walk around with a ton of Dr. Tappan cards. So if I give you a card, I'm sorry.
Right.
You get the drift? Okay. We're gonna pay some bills, be right back on the Roland Grounds Not Just Sports Entertainment Show. Don't go nowhere. Entertainment show. We're going to be wrapping it up very shortly. Before we do that, I want to just give a special thanks to a couple folks that without them we wouldn't be able to make this show go forward. We have Queen as our timekeeper. He's very efficient and punctual in what he does, so I want to thank you, Cooney. Happy New Year to you. We have One Shot Fred. Yes, folks, there's a reason why we call him One Shot Fred, because he only needs one shot to make you like what he takes. And that, by that I mean the photo. Congratulations, Fred. Wishing you a great New Year in 2013. We also have a young lady who we're hoping is going to be with us for a long, long time. She goes by the name of Tanja. She does the makeup for us, so we want to recognize her as well. So folks, please help me and give all those wonderful people a hand. It's no secret, if you've been watching this show, or if you haven't been watching this show, basically what we're talking about is staying healthy. Staying healthy by making yourself go to the dentist. Dr. Tappan is one of the best dentists in the world. No, I have not been to all of the dentists in the world. I don't think I have to do that. I'm just speaking from my personal experience that I've had with him, and I highly recommend that everybody, please, make your way to the dentist. And if you need some help, you can call me. I'll give you my information. But more importantly, call Dr. Tappan. 301-565-8220. Okay, Dr. Tappan. We're getting ready to wrap it. Now, why don't you tell us a little bit about some of the future projects you're working on, some of the things you're looking forward to. It's 2013. You and I are real big on bucket lists. And we have bucket lists, folks. That's another show, folks. We'll talk about the bucket list later. But Dr. Tappan, tell us about what you have going on, what we can look forward to.
One of the things we talked about is self-esteem. And as I said, I try and instill as much self-esteem as I can through my cosmetic dental work. But one of the other ways that I'm working on self-esteem issues is through a book that I'm working on now. It has to do with goal setting and lifestyle management. I've read a number of books, taken a bunch of courses on how to achieve your goals, how to become a success, how to become better at what you do. So basically what I'm doing is I'm putting together a workbook that explains a formula that assists people in setting and achieving their goals. So by doing this, I just feel like it's a way that I can present it to people. It's quick, it's easy to understand, it's easy to fill out, and I'll be teaching these courses throughout the DC metro area. Wherever I can get in, I'll fit in. I'll go to schools. I'm doing one now at my church, and it's just a way of giving something back. But at the same time, I strongly believe in that if you help other people get to where they're going, it's going to better assist you in getting to where you're going.
One of the things that I also want to do going forward, what advice would you give young people? Sometimes you might have them not brushing their teeth, and not doing it consistently. What advice would you give to them how important it is to brush your teeth and do those chops?
One of the things that I tell young kids is stay on your parents about getting them to the dentist. A lot of kids, it's just like going to church. I go to church where the kids bring their parents to church. That's interesting to me because if you can get it instilled in your children to do certain things, and the parents just kind of jump on board with it. So, I tell all kids, you don't want to be, that one person that people don't want to talk to because of their breath, or you don't want to be that person that's missing teeth or having problems, later on in life, because it's really a bad way to go. So if they can get this in their minds early on, it becomes an easy thing to do, and it's like any other habit. Once you start to develop these habits, it just becomes easier.
Well,
it really does.
Well, one of the things that I find to be very interesting in regards to the book that you're writing is that your book is not going to be set up, if you will, like traditional books.
No, it's not.
So why don't you talk a little bit about that? I think we have a couple minutes before we wrap up.
Well, basically, my workbook is set up so that before you go to the next chapter, you have to do work. You have to do work. And by doing this work, you have to list your goals, you have to write down dates and times, you have to put together action plans, but you have to do this before you can go to the next chapter. And if you do it, it's a formula. It's just like making a cake. If you put in A, B, and C, then you're going to get D. If you put certain formulas together, and if you follow that formula, basically, Skip, success leaves clues. So if you do what other people do, you will get what they have.
Exactly.
So it's not rocket science, it's not reinventing the wheel, but it's basically pulling together a number of things that are simple and easy to do that, again, are regular habits. If you start to, it's just like working out. If you work out regularly, you're going to miss it when you don't work out. If you become a guru of goal setting, then you're going to be disappointed when you don't reach your goals. When you don't put together an action plan. When you don't put together dates and times to try and reach them. Because everybody wants to be successful, everybody wants to grow, everybody wants to prosper, but everybody doesn't want to put in the work. So this is a small amount of work to get tremendous results. These are habit-changing type of experiences that create successful lives later on in life.
And basically, folks, what we're saying, the three gentlemen that you're watching now, Eugene Helms, Dr. Tappan, and Mr. Self-Empowerment, is that it's okay to create a thirst for something. When you create a thirst for something, you want it. Well, why don't you in 2013 create a thirst for wanting to go to the dentist? Why don't you create a thirst for wanting to love your family more and do all these wonderful things that'll help make you more whole and, more importantly, keep you healthy? Dr. Tappan can get you where you need to go. It's not myself, Mr. Self-Empowerment, talking to you like I'm a dentist. It's Mr. Self-Empowerment talking to you about my past experience, which I talked about that earlier. Now I cannot stop smiling. My wife tells me I take more pictures than anybody else now. It's contagious. So please jump on the bandwagon, and by all means, in 2013, make your way to the dentist. Before we sign off, Dr. Tappan, why don't you give everybody your information one more time?
Sure. Phone number is 301-565-8212. Again, that's 301-565-8212. You can reach us on the web at drtappan@verizon.net. drtappan@verizon.net.
Well, folks, that's going to wrap up another segment of the Roland GRIMES, Not Just Sports Entertainment Show. As your host today, Mr. Self-Empowerment, we want to leave you with good wishes, best regards in 2013, and remember, no excuses in 2013. Make your way to the dentist, and if you do that, I can assure you, you'll have a better smile, you'll feel better about yourself, your self-esteem will go through the roof. Until the next time, on the Roland GRIMES Not Just Sports Entertainment Show, on behalf of Eugene Helms, CEO of Helms Fitness, Dr. Marcus Tappan, one of the best dentists in the world, and Mr. Self-Empowerment, take care. Congratulations, we're in a new year. Make it happen.